How can Mingle Health add value compared to EMR-based reporting solutions?
Great question. I think it can be summed up by saying Mingle gives you flexibility, the value of which will become obvious to you as you try to meet the quality standard to affect full collection of your shared savings. You'll encounter many challenges in your measurement process and should typically more easily find solutions with Mingle and using the MIPS or Medicare CQM processes instead of the eCQM processes. Part of the advantage is the EHR compared to the third party approach to data. Most ACOs have multiple tax ID number practices representing multiple distinct EHR and practice management systems. Now, EHRs do not play well together. I find that most say, of course, we can handle your overall system needs. All you have to do is import data from all the other practice EHRs and translate it to our data model. Now, they leave you with a monumental task with too little support and a ready excuse for their underperformance. When I say monumental, think monumental effort, monumental expense to build and maintain an infrastructure that works. An expense that grows every time you add a new practice or a practice that changes EHR. Now, the other part of the Mingle advantage relates to the difference between eCQM and registry requirements and processes. eCQMs are exclusive. You have to use certified EHR technology beginning to end. You have to have the documentation templates precisely built. Your providers have to use the prescribed documentation workflows. You cannot manually manipulate the data in any way. You cannot fill any holes with data collected in any way from any other source. And ECUMs commonly fail as they try to blend data from multiple EHRs or even multiple instances of the same EHR. MIPS and Medicare CQMs, in contrast, are flexible and inclusive. You can be all electronic, just like eCQMs. You can exclusively use certified EHR technology, just like eCQMs. But you can include data from any source collected in any way. Data simply has to be accurate to be valid in a MIPS or Medicare CQM submission. Certification is not required. Electronic workflows are not required. You can solve your problems in any fashion that works, which is a big advantage when you're competing with all other ACOs to hit the quality standard and collect your shared savings.